Well, I guess I would say first to the young doctors, take a look at the x-rays of dentistry that walks in the door and ask yourself, could you do better than that? And in many instances, I think you would say, yes, I can. And yet, these doctors are practicing dentistry for decades at a time. So the standard is really easy to meet. Everybody, all the doctors in the company are excellent. They have no worries about meeting the standards and having their license revoked or removed. So I think they get too edgy about ending a career. I think they're more, I mean, I guess going back to my own experience, I was more concerned about what would the patient think if I did something or provided some care that was less than perfect. Would the patient know about it, or would the patient be hurt, or would I be letting somebody else down? Because I think dentists and the young doctors in particular are concerned about being perfect and living up to someone else's expectations. They go through dental school with these high expectations about what they're supposed to provide, and the professors get them all concerned about being able to do it as well as the specialist. Working to perfection. Nobody, including those professors, can do perfect root canals until they do imperfect ones. You don't start off with doing perfect. You can start off doing good, and good works. So you don't have to be perfect. And in all those specialists that are out there barking about you shouldn't be doing any root canals, or you shouldn't be taking any teeth out, or you shouldn't be doing something because it's a specialist work, they all did really bad cases, because you can't do really good cases until you go through that time when you're learning how to do it really well. So I was just honest with my patients. Once I finally realized that they wanted me to do it, they were willing to accept good rather than perfect, because they wanted me to do it rather than walk out the door to some specialist. I would say, well, I'm not a specialist. I can do a good job. It may not be perfect, but I think it'll be fine. If it's not, I'll let you know. You get some sort of permission from the patient that it's okay with them that you're not perfect. That seemed to help a little bit. And when it's a team approach between you and the patient, and you quit sort of taking on all the responsibility that they brought the problem to you, and suddenly this is all your problem to fix and not their creation, and you're willing to help them as best you can, you have to let go of that a little bit. So once you sort of mentally get to that point where I don't have to be perfect, I didn't create this problem, but I'm willing to try to help them fix their problem, you can step across that sort of fear of, what if I don't do it exactly right? So a lot of it's a little communication with the patient. Certainly you want to practice those things, but you can't practice it until you do it. You just have to do it. It's just like the first filling you did. Your first filling was a lot worse than the one you just did yesterday. The first extraction you did was a lot worse than the one you did yesterday. Your first injection. So you have to quit thinking that you're going to start at perfection. Everybody in the company is good enough to do good work. They all are. If you don't think you can do it at the standard, well, learn how to do it at the standard, but I know they all can. So it's just a matter of mentally getting past this. I have to be perfect, and I have to take on all the problems the patient made for him or herself.